Hello, my name is Angela Ferrantino, and this is my presentation on anabolic androgenic steroids. In this presentation, I will cover what are anabolic androgenic steroids, how steroids are used, some of the commonly used anabolic androgenic steroids, why steroids are used, the metabolism of these kinds of steroids, the multiple effects on the brain from steroid use, and their impact on society. What are they? The anabolic androgenic steroids are synthetic variations of the male sex hormone testosterone and its derivatives. Anabolic refers to muscle building, and androgenic refers to increased male sex characteristics. Some common names for anabolic steroids are gear, juice, roids, and stackers. Steroids were initially used clinically for various muscle wasting conditions associated with COPD, alcoholic hepatitis, and trauma, such as burns, surgery, and radiation therapy. Later on, the steroids were used to benefit psychiatric conditions such as depression and melancholia. However, early reports of the positive mental effects of anabolic androgenic steroids were gradually replaced with reports describing undesirable side effects on behavior. How steroids work. By altering testosterone to prolong its effects, steroids act on androgen receptors on certain cells, including muscle cells, increasing tissue production. Steroids also block the effects of cortisol, a catabolic or muscle-destroying hormone. Exercise increases the availability of androgen receptor sites. Steroid use must be accompanied with physical exercise to increase muscle size and strength. The goal would be to saturate these receptor sites. Some users will cycle steroids, taking a specific dose of steroids at a time, stopping for a period of time, and then restarting. Then some people stack steroids, using them in combination, often an oral and an injectable. Others will pyramid, where doses increase, then decrease in a 6 to 18 week period until they reach a time without any use, in order to keep the receptors sensitive and avoid crash, which occurs when stopping steroids acutely. The different types. There are two types of anabolic steroids. The first kind are oral steroids, and they have to be absorbed by the gut and then metabolized by the liver. The second kind are injectable steroids. Steroids that are injected into muscle tend to be absorbed more slowly and they bypass the liver. The different types of oral steroids include Anadrol 50, Anavar, Andriol, Halotestin, and Teslac. The different types of injectable steroids include Testex, Decaderbilin, Depo-testosterone, and Drolban. Why steroids are used. Anabolic androgenic steroids, such as synthetic derivatives structurally related to testosterone, were introduced in the 1930s. Anabolic steroids have been used by athletes since the 1950s, but they did not become widespread drugs of abuse in the general population until the 1980s. Anabolic androgenic steroids are misused to a high extent in sports by athletes to improve their physical performance and personal appearance. These steroids are used to achieve muscle hypertrophy, which involves an increase in size of skeletal muscle through a growth in size of its component cells. Sports federations consider the use of these drugs in sports as doping. Although the misuse of anabolic androgenic steroids is not a good thing to do, some benefits include possible increase in muscle mass and strength, mobilized fat stores, and increased erythropoiesis, which is the production of red blood cells. Based on a study From the National Household Survey on Drug Abuse, there are more than 1 million current or former anabolic androgenic steroid users in the United States, with more than half of the lifetime user population being the age of 26 or older. And more than 300,000 individuals reported that they have used anabolic androgenic steroids in the past year alone. Metabolism of anabolic androgenic steroids. In the general metabolism of anabolic androgenic steroids, metabolic changes occur in the basic structure of all steroid molecules. The changes are grouped into two kinds of metabolism, phase 1 and phase 2. In phase 1, the steroid is converted by enzymatically catalyzed reactions such as oxidation, reduction, or hydroxylation into more polar compounds to inactivate the drug and to facilitate its elimination from the body. In phase 2, these reactions act to couple the anabolic steroid or its metabolite with guaranic acid or sulfate. Conjugation helps elimination of the steroid from the body. Impacts on the brain. Anabolic steroids can confuse the brain and the body. Your body's testosterone production is controlled by a group of nerve cells at the base of the brain, called the hypothalamus, which regulates hormone release. The hypothalamus also does a lot of other things. It helps control appetite, blood pressure, moods, and reproductive ability. Anabolic steroids can change the messages the hypothalamus sends to the body. This can disrupt normal hormone function. Another area of the brain that is affected by steroids are androgen receptors, which bind to testosterone. Testosterone and anabolic steroids have been found to affect the central nervous system in laboratory animals and humans. Their locations of effect in the brain are closely linked to centers that regulate mood, sexuality, and aggression. It has been studied that steroids affect the brain's serotonin and dopamine neurotransmitter systems. Dopamine is a multifunction neurotransmitter participating in the regulation of mobility, learning, emotions, appetite, and positive reinforcing effects. It is an important neurotransmitter for operating the reward system, so dopamine is essential for addiction development. Serotonin, in turn, regulates sleep patterns, movement, appetite, sexuality, and emotions. According to some studies, it is also related to memory operations and sustainable concentration. Among other findings in animal experiments, it was found that an anabolic steroid, nandrolone, changes the dopamine system response to stimulating intoxicants. The release of intoxicant-induced neurotransmitters lessens, and so does the pleasure obtained from using intoxicants. In some studies, androgenic compounds have been shown to have direct activating functions for dopamine and serotonin release. The use of anabolic steroids can cause considerably long-lasting changes in the user's brain neurotransmitter pathways. The serotonin system often reacts the strongest to nandrolone administration. This supports the previously stated side effects such as aggressiveness and mood changes, because decreased serotonin levels in the brain relate to the aggressive and uncontrolled behavior of both humans and animals. Anabolic steroids work differently from other drugs of abuse. They do not have the same short-term effects on the brain. The most important difference is that steroids do not trigger rapid increases in dopamine, which causes the high that drives people to abuse other substances. However, long-term steroid abuse can act on some of the same brain pathways and chemicals, including dopamine, serotonin, and opioid systems, that are affected by other drugs. This may result in a significant effect on mood and behavior. Impact on society. Anabolic androgenic steroids are a popular choice for bodybuilders and athletes. Even though anabolic steroids do not cause the same high as other drugs, they can lead to addiction. Studies have shown that animals will self-administer steroids when they have the chance, just as they do with other addictive drugs. People may continue to abuse steroids despite physical problems, high costs to buy the drugs, and negative effects on their relationships. These behaviors reflect steroids' addictive potential. Research has further found that some steroid users turn to other drugs, such as opioids, to reduce sleep problems and irritability caused by steroids. Anabolic, androgenic steroid users appear particularly prone to opioid use. There may well be a biological basis for this association, since both human and animal data suggests that anabolic androgenic steroids and opioids share similar brain mechanisms. Risks of taking steroids. Some of the risks that arise when taking steroids are an increased risk of joint related injuries, positive urine tests, and side effects that include acne, anxiety, aggression, decreased sperm production, depression, liver tumors and cysts, mania, personality change, irritability, acts of violence, testicular atrophy, trouble sleeping, suicidal thoughts, and many other side effects. In this presentation, the topics that were covered were what are anabolic androgenic steroids, how steroids are used, some of the commonly used anabolic androgenic steroids, why steroids are used, the metabolism of these kinds of steroids, the multiple effects on the brain from steroid use, and their impact on society.